Congestive Heart Failure by RachelBrubaker, American Public University, Professor Bowers, Science 132. In today's presentation, I will be discussing several important topics regarding congestive heart failure. We will first start by explaining some of the reasons why I picked congestive heart failure. Next, we will define congestive heart failure. Following our third definition of CHF, we will discuss the history behind CHF. After we review the history of CHF, we will introduce several statistics, which will include location, gender, and several risk factors. Next, we will discuss the financial cost and loss of productivity associated with CHF. These costs will consist of lifetime costs, country cost, and loss of productivity. We will then discuss the anatomy and physiology of the condition. It will include the difference between a healthy functioning heart and an abnormal functioning heart, as well as the symptoms and causes. Furthermore, we will discuss diagnosis, treatments, and prognosis. Last, we will conclude our presentation with our conclusion. Therefore, identifying congestive heart failure and knowing the statistics, costs, symptoms, and treatments can contribute positively to living a long, healthy life. There are many reasons why I have chosen to discuss congestive heart failure. First, I have always had an interest in the human body and promoting optimal health. Second, congestive heart failure affects numerous individuals all over the world. On a more personal level, I have had several extended family members who have lost their lives to CHF. The knowledge gained through my research will not only improve my current lifestyle, but will allow me to share this information with others in the hopes of improving their overall health and possibly preventing the later onset of congestive heart failure. Next, I will define congestive heart failure. Congestive heart failure is a prevalent condition that affects numerous individuals all over the world. What is congestive heart failure? Several terms are used to define this condition. These terms are congestive heart failure, CHF, and heart failure. These terms will be used interchangeably throughout this presentation. Congestive heart failure is a condition that can arise in one or both sides of the heart. Congestive heart failure, or CHF, is a condition that affects the blood circulation of the body. More specifically, CHF occurs when the heart inadequately pumps blood throughout the body. The inadequate supply of blood is a direct result of damaged heart muscles. Because of this irregular functioning, several conditions, symptoms, and even death can occur without proper treatment. Please take a minute to observe the picture as it illustrates the difference between a healthy heart and heart failure. Now let's look at the history behind congestive heart failure. When looking at the history of congestive heart failure, there have been many discoveries that have allowed us to not only identify congestive heart failure, but also distinguish between and understand normal and abnormal cardiothoracic functioning. One of the first men to discover the basis of congestive heart failure was William Harvey. William Harvey discovered the circulatory system in 1628, which led to the identification of normal and abnormal functioning. 2 decades later, Einthoven invented the electrocardiography in the 1890s, which allows doctors to record the heart's electrical activity. Just 5 short years later, Roentgen Wilhelm Conrad discovered the X-ray machine, which allows doctors to take images of the heart. Lastly, Ing Edler and Helmut Hertz discovered the use of the ultrasound, which allows doctors to view the cardiothoracic structures. All of these men have significantly impacted medical advancements and provide the necessary tools to identify and diagnose abnormal conditions of the heart. Next, we will discuss several statistics. Several statistics and risk factors are associated with congestive heart failure. Congestive heart failure tends to be prominent in Western countries and occurs more frequently in older-aged individuals. When looking at gender, women are more susceptible to contracting congestive heart failure versus men, but women tend to have a higher survival rate. More specifically, when looking at men and women, congestive heart failure occurs 1 in every 9 men and 1 out of every 6 women. Also, there are several risk factors associated with congestive heart failure. Some of the risk factors associated with congestive heart failure are coronary heart disease, high blood pressure, diabetes, myocardial infarctions or heart attacks, cardiomyopathy, and heart arrhythmias. These statistics and risk factors will allow us to get a more in-depth understanding of how serious CHF is, along with several factors to avoid. Now we will discuss financial cost. Financial cost and lack of productivity are always a burden despite the circumstances in one's life. When looking at congestive heart failure, several costs can burden members of a country or society. Congestive heart failure can require a lifetime of treatment and ranges from $100,000 to $119,000. Looking at the United States as a whole, $30 billion is spent annually for the treatment of congestive heart failure. In addition to financial costs, an individual's loss of productivity can affect whether or not they have the finances to pay for that treatment. Loss of productivity solely depends on the stage of congestive heart failure. Advanced stages can significantly reduce the levels of productivity, while more mild symptoms can result in more productivity. When observing the table, there are 4 classes of productivity. As you can see, stage 1 has no limitations, while stage 4 has extreme limitations, meaning that the level of limitation increases with the stage. Thus, both financial burden and loss of productivity due to physical limitations can hinder individuals with congestive heart failure. Next, we will discuss the anatomy and physiology of congestive heart failure. The anatomy and physiology of the heart are essential to identifying congestive heart failure. A normally functioning heart circulates oxygen-rich blood throughout the body, while a heart with heart failure or congestive heart failure will inadequately pump blood throughout the body, resulting in a reduction of volume and oxygen. In addition to the heart's normal and abnormal functioning, it is also important to have a basic understanding of several symptoms and causes of congestive heart failure. Symptoms can include but are not limited to pain, anxiety, lack of energy, shortness of breath, liquid buildup, and fatigue. Also, there are several causes of congestive heart failure as well. These causes include heart diseases, damage to the heart attack, high blood pressure, diabetes, alcoholism, and valvular heart disease. Thus, all of these functions, symptoms, and causes allow individuals to identify and pursue treatment. Next, we will discuss diagnosis, treatments, and prognosis. When diagnosing congestive heart failure, there is no one test that diagnoses the condition. Instead, several tests are used to identify congestive heart failure. These tests include physical exams, electrocardiograms, Doppler ultrasound, nuclear heart scan, and stress test. Physical exams can observe whether a patient is showing physical signs of CHF. These signs can include swelling and fluid retention in the abdomen, legs, and feet. Electrocardiograms are also essential in identifying CHF as they record the heart's electrical activity. Abnormal electrical activity indicates improper functioning. Doppler ultrasounds can be used to observe the flow of blood in the arteries. If the blood flow is compromised, this can show abnormal functioning. A nuclear heart scan would then be used to detect blood flow and clots. Lastly, stress test or physical test can measure the heart's response to stress. Positive responses show the heart's adequately responding to stress, while negative responses indicate improper functioning. Next, we will discuss the treatments and prognosis. Several treatments are used to treat congestive heart failure. Several common treatments include, but are not limited to, lifestyle changes, medications, and surgery. Lifestyle changes refer to the individual's diet and exercise regimens. Diet refers to incorporating healthy food choices, while exercise is engaged in daily. Medications include beta blockers and ACE inhibitors. Beta blockers and ACE inhibitors work to reduce the individual's blood pressure. In doing so, less stress is put on the heart. Surgeries for congestive heart failure include, but are not limited to, heart transplants and inserting a cardiac defibrillator, which administers a shock to put the heart into normal rhythm. Unfortunately, despite treatment options, the prognosis is grim, but medications, lifestyle changes, and surgery can prolong one's life. Please take a second to view the short video on congestive heart failure, as it also defines and discusses diagnoses, treatments, and prognosis of CHF. My conclusion follows. Thus, congestive heart failure is an ongoing condition that has raised much concern in the United States today. CHF is a condition that affects the heart's ability to pump blood throughout the body effectively. This ineffectiveness can lead to several adverse health effects and even death. Luckily, some treatments and medications can prolong one's life. These treatments and medications can be a substantial financial burden on many families. Unfortunately, Despite medical advancements, their prognosis is grim without prolonged treatment. Therefore, understanding CHF and familiarizing oneself with the statistics, costs, symptoms, and treatments, one could effectively detect early signs of CHF or engage in lifestyle choices that would aid or promote early prevention. My reference slides follow. I hope you've enjoyed this presentation.